Nick, glad to have you along here. Lauren of Rich Consulting joining me this morning, and our in-studio guest. We do this on Monday mornings and talk about therapy and I guess the state of our minds, sometimes dealing with all the stress in the world. This kind of came about during COVID-19 pandemic. Many people kind of freaking out over it, and it's natural to have concerns. It's natural to be worried, depressed even, with the lack of socialization and stuff. And we've hit many topics, but today, Lauren, you really teased me here in my mind, because you told me we were going to talk about how to select a therapist in a way, and some of the myths involved with selecting a therapist. I mean, how do you know who's right for you? Does the therapist have to know exactly what you're going through experience of it in their own lives, or how do you select? It can be overwhelming.
I don't know how mental health got to be this way, but for whatever reason, the standard is that I have to find a provider who has had an identical or similar experience to what I have experienced.
Right.
No other field has this standard. I don't know if we've done this to ourselves or how that evolved over time, but you would never expect that your neurologist has had brain surgery. That would
Right.
not be a criteria to find a good neurologist. But
Sure.
it seems to be a criteria that if I have an alcohol problem, then I need to see somebody who's in recovery and who's had an alcohol problem.
Why do we think like that? Because, I mean, all the specialty surgeons, and it would be like your gallbladder surgeon couldn't take your gallbladder out unless
That's
they've
exactly
had their own taken out.
Yes, which is really an unfair expectation. I don't, like I said, I don't know how we got there, but we are definitely there. The problem is that people are creating obstacles to treatment that don't need to be there. And if we take that myth, that would be like saying that no man would ever be good at being an OBGYN because they've never been pregnant, they've never delivered a baby, that men OBGYNs would just not be a good option for us. And clearly that is not the case. There are amazing male OBGYNs everywhere out there, okay? So if we think about it in that context, therapy is still a specialty. People have specialties within general treatment, and you wouldn't see a cardiologist for an oncology problem, okay? Mm-hmm. So when you're looking for a provider, some of the things that you need to think about are how important is that for me that they've had a similar experience or no experience at all. Personally, for some people, especially in the veteran and law enforcement community, I think it's an excuse not to go seek treatment because it's so easy to say, well, I don't have that provider who's been an infantryman. You know, that is so outright and easy to say because it's nearly impossible to find. I think I can name 3 in my lifetime that I have known who have been in service and then they become a provider. And just because they've had that experience doesn't necessarily make them a good provider.
Well, they had their own experience with it too, which could be totally different and cloud the view of the person that had a completely similar experience.
Yes,
but
therapy is not about the provider. Therapy is about you, the client. So let's take this in context for the veteran and the law enforcement population because that's who I see the most of. I have all the branches to cover and to know. I have to know about MOSs, NECs, job titles. One rank in the Army is not the same rank in the Marine Corps. There is no way that I can retain all of that information. And to top it off, if women are not allowed in the infantry, topic for a different day, if women are not allowed in the infantry, then there's no way I can ever have your experience. And that's an okay thing because at a certain point when you maybe see providers who've had the exact same experience, it becomes less about you and your processing and more about the provider and their experiences.
Well, does it mean that maybe sometimes people are trying to be too specific in their treatment? Because, I mean, let's face it, though. I mean, maybe I'm wrong, and I'll ask you. I mean, trauma's trauma, isn't it?
Trauma is trauma. That's absolutely right. All of the symptoms look the same. Doesn't matter what the event is.
Whether you were involved in a really bad accident and lost one of your children in the accident, or maybe something that is very traumatic, and it'd be similar to an infantryman who lost a friend on the front line, right?
Death is death, yes. And my statement to people is always when they say, well, you're a civilian or I won't see a civilian. You know, some of them sit in my office and they say, well, I don't want to see a civilian. Well, I'm still a civilian. You know, well, you're different. Well, the thing about it is that I don't have to know that war is horrific, I don't have to witness that firsthand to understand that process. And my general statement to people is, I don't have to use cocaine to know that it's addicting. Okay,
Right.
this is a pretty simple understanding. The most important thing for you to remember about selecting a provider is that I cannot believe how many you can use this analogy, but for the Star Wars fans out there, we are the Yoda to your Skywalker, okay? It is your own journey. The Force is already in you. We are simply guiding you through the process. That is the main focus of the Therapeutic Alliance.
Right. Now, as a therapist, have you seen increased traffic due to the pandemic? Has the pandemic played a role in
I
either?
have not, but that doesn't mean that others haven't.
Well, even though, let's say you're dealing with people that have or been dealing with trauma from serving in Afghanistan or some other form of trauma, adding a pandemic, adding the rioting on television, it really is just added. It's another layer of
added stress.
and
For
that they're
some it
dealing with.
is. For some it is, yeah. But you have to remember that the veterans have dealt with so much stress that a lot of them are already accustomed to this. I think it's the civilian population that's struggling the most. And to that, I have to give all of my veterans credit. They've all done an exceptional job in this time. We've not had any issues whatsoever.
Don't
Probably
they-
because they already do the work.
Well, I was going to say, do they not maybe handle it better? Doesn't it not put them more into what would be a normal mindset for them?
Sure.
Being
Well, they
more cautious, being more alert, being more. Does it not maybe busy their mind back to a level that they feel more comfortable with? Does that make
Everybody
sense?
handles stress differently, and for some of the people that I see, they handle it exceptionally well because they've been in a lot more stressful scenarios.
Well, things about stress too, to me it would be knowing what you're stressing about is a lot better than the anxiety of thinking you should be stressed out and you don't know why you're stressed out. At least when you see things happening, you know what you're stressing about. Does that make sense? And there's almost a relief in that.
But that's the kicker, is sometimes people don't know why they're stressing. They just know that they don't feel good. There's a lot of internal chaos. I'm not sleeping well. I'm depressed. I'm anxious, whatever it may be. And so I don't hardly ever ask people in the first session what brings you in, because at that point they don't really know. It may take me 2 or 3 sessions or a year to ask that question, even sometimes. I had one veteran who, have to say, has made my favorites list for sure. And I started seeing him a couple years ago in the fall. He would take sporadic breaks and not come back for a while. And then maybe a year into it, I said, what made you come into therapy? And I've never had anybody give me this answer before.
What
ever.
was it?
He said, well, first, I came because you were attractive. But, then I realized you had the answers. And that was, I've never had that response from anybody else. But the crazy part is, he's wrong. He's wrong. Because if I'm Yoda to your Skywalker, he already has the answers. And he did. He just didn't know how to get there.
Mhm.
So it's all about processing. You have to give your provider a chance. You have to give us a chance to build rapport. You have to give us a chance to get to know you. And so to that I say, if you are seeing somebody who's a new provider to you, give them 5 to 6 sessions. And if at session 5 or 6 you are still not satisfied, you don't feel like that connection is there, go find somebody else.
Mhm. Makes sense to me.
Absolutely.
So we make it a little bit harder on ourselves to try to find a therapist. It's nowhere, possibly that level of stress we're dealing with, we let that bleed over into the selection process, and then it can be so overwhelming that you don't actually make a decision, so you continue.
If you think about what you're asking, if I see on a low end 20 clients a week, and they all expect that I have similar life experiences to them, that means that I have to have been homeless at some point in time, had an alcohol or drug addiction, been sexually assaulted, lost a child, adopted children. I mean, think about what you're asking here. This is not a reasonable request.
Right.
Again, the myth about having a provider who's experienced exactly what you've experienced is exactly that. It's a myth. The most important thing is that your provider is knowledgeable, that they are an authority figure in the sense that they can offer you knowledge and walk you through the process, and that there is empathy coming from your provider. That is the most important thing about the Therapeutic Alliance.
Mm-hmm.
On your end, the most important thing is that you trust that we can get you through the process.
Right.
I would even say that 80% of therapy is about rapport. It's not necessarily about treatment modality. It's not about how hard you work. It's about the Therapeutic Alliance. The remaining 20% is is the client ready to change, and what type of treatment we deploy.
Now, how can someone reach out to you, Lauren Rich of Rich Consulting, and discuss more, find out more, or maybe get that help that they're needing? Because so many people dealing with stress, from people dealing with trauma to people just not really sure what's bothering them.
Sure.
There's a lot of people have no idea what's bothering them. You just know you're not right, and you need to talk to somebody.
The easiest way is 918-912-2266.
Just that simple.
That's simple.
And of course, you're on the internet.
Yes, the interwebs, the Google machine, social media.
Lauren Rich of Rich Consulting. Well, fascinating. You shed a lot of light on that, so don't be browbeating yourself.